So when you come in for Botox, we're going to figure out what zones to do, and usually we'll do forehead and crow's feet and frown. And then sometimes the center of the glabella, sometimes bunny lines, sometimes lip lines, sometimes DAOs. So when we inject those, generally we'll treat the skin with a little chill pack to make the little needle injection very comfortable. We use a very tiny needle, a 32 gauge needle, so you barely feel it go through the skin. But the Botox has a little bit of a sting, and the sting only lasts for a second. So then after the injections, for about 5 minutes, you'll have little bumps that look visible, kind of like if you had a mosquito bite. By the time you get home, those are all gone, and generally speaking, it's pretty rare that you get a bruise from a Botox injection. Then it's going to take about 2 to 5 days for the Botox to start working its magic. So it takes that long for the Botox to bind to the junction of the nerve and the muscle interface and make the muscle not pull as strongly as it used to. So in about 5 days, you should see your Botox come into full effect. At 2 weeks, it's clearly at its peak, and then it's going to last you about 3.5 to 4 months after that. When we look at our Botox patients, we see that they fall into about 3 different categories. There's the person that treats themselves either for Christmas or for their birthday, and they do it once a year. There's the person that wants to have maximal correction all the time, and they will do it about every 4 months. And then we have a subset of patients, some of them younger, who have either tension or migraine headaches, and they will tend to have their Botox on a 3-month cycle, which is about how long it has headache relief for. So Botox should last about 3.5 months. And when you start to get movement back isn't when you get the wrinkle back. So that determines how often you might want to do it. So you might not get the wrinkle back for 5 months, so you could some people might space it out to 5 months. Some people just always want to have no frown, no worry lines, no crow's feet. They'll tend to do it 3.5 to 4 month intervals. So that's kind of a good guide for how often to do it. It works indefinitely. We do find that people who have a high metabolism maybe metabolize it a little quicker. So some of our people that are in the fitness industry, personal trainers, yoga instructors, things like that, might get a shorter duration because the theory is that the way we get rid of heat when we exercise or work hard is through our head and through our hands and our feet. So as that blood flow is increased, especially right after Botox in the first week or two, you may have such a high blood flow situation that some of your Botox gets carted away before it really can bind to the muscle. So that's one little tip that you can do to get more for your money or get a longer duration. It's probably your best value for the buck. When you look at what you can do, works virtually every time, works great, and makes you look fresher, more relaxed, can get rid of a frown that maybe is off-putting to people. Botox is clearly the #1 aesthetic non-surgical treatment in America today, and that's probably worldwide.